Hey there, and welcome to Medicare 101. If you're turning 65 or just want to understand what Medicare is, you're in the right place. What is Medicare? Medicare is a federal health insurance program primarily for people 65 and older, but it also covers certain younger people with disabilities or end-stage renal disease. The four parts of Medicare. There are four parts of Medicare. Part A is hospital insurance. Part B is medical insurance. Part C is Medicare Advantage. We'll explain that in a sec. Part D is prescription drug coverage. Parts A and B, otherwise known as Original Medicare. Original Medicare is made up of Part A and Part B. Part A helps cover hospital stays, nursing facilities, and some home health care. Part B helps cover doctor visits, outpatient care, and preventive services. Generally, Medicare Part A doesn't cost you anything so long as you or your spouse have worked their 40 quarters. However, Medicare Part B does have a monthly premium of $185 in 2025, and that number is subject to change yearly. Part C, otherwise known as Medicare Advantage. Medicare Advantage, Part C, is offered by private companies approved by Medicare. It usually includes Parts A and B, and often Part D too. Many also include extras like dental, vision, and hearing. Now let's talk about Medicare supplement plans, also called Medigap. These are plans you can buy to help cover the remaining 20% you are liable for on your Medicare Parts A and B services after Medicare pays. They work with Medicare, not instead of it, and they give you more predictable out-of-pocket costs. But keep in mind, they usually don't include extras like dental or prescription drugs. So, what's the difference between Medicare Advantage and Medicare Supplement? Here's a quick breakdown. With Medicare Advantage, you're getting everything bundled into one plan. That's Part A plus B, and usually Part D for prescriptions. Medigap, on the other hand, helps cover the remaining 20% on your Part A and B services after Medicare pays 80%. Networks. Medicare Advantage plans often have networks, like HMOs or PPOs. That means you might need referrals or to stay in-network for your services. With Medigap, you can go to any doctor or hospital that accepts Medicare. No network restrictions. Extra benefits. Medicare Advantage plans can come with extra benefits. Things like dental, vision, hearing, and even gym memberships. Medigap is more straightforward. No extras, just help with out-of-pocket costs. Drug coverage. Drug coverage is usually built into a Medicare Advantage plan. With Medigap, you'll typically need to purchase a separate Part D drug plan. Cost. Advantage plans often have lower monthly premiums, but you might pay more when you actually use care due to copays and coinsurance. Medigap plans usually have higher premiums, but they cover more, so you pay less out of pocket when you go to the doctor or hospital. Flexibility. Medicare Advantage is more bundled and managed, but you're limited by the plan's network. Medigap gives you more freedom to see providers, but you'll need to juggle separate policies. So which one's better? That depends on your health needs, budget, and how much freedom you want in choosing your doctors and hospitals. If you're not sure, a licensed agent can walk you through both options. Part D, prescription drugs. Part D helps cover the cost of prescription drugs. You can get it through a standalone plan or included in a Medicare Advantage plan. What Medicare doesn't cover. Medicare doesn't cover everything. Things like routine dental, vision, hearing aids, and long-term care aren't included unless you have a plan that adds them in. Enrollment timing. Your initial enrollment period starts 3 months before the month you turn 65 and ends 3 months after. You do have other enrollment periods as well, such as the annual enrollment period, which is from October 15th through December 7th. You also have the open enrollment period, which is from January 1st through March 31st. how to choose a plan. Choosing the right plan can be confusing, but that's what we're here for. Our team of licensed health advisors at Prosperity can walk you through your options. No pressure, just clarity. If this video helped you out, give us a like, subscribe for more content like this, and drop any questions you may have in the comments. And if you're ready to explore your Medicare options, give us a call or visit our website. The link is in the description.